Diabetes literacy is a pan-European project aimed at strengthening patient self-management by exploring what exists and works, as well as the potential for improvement. Why is this needed now? Diabetes is the fourth largest cause of premature death in the European Union and affects 52 million people. The alarming rise in all ages of type 2 diabetes, which if untreated can be disabling and life-threatening, costs member states between 5 and 15% of their total health expenditure. With an aging population and growing rates of obesity, these costs are expected to greatly increase. Self-management for those with diabetes, healthy diet, exercise, monitoring, and regular medication, although challenging, is imperative for the treatment to be successful. However, to self-manage their diabetes, patients have to understand their condition, know how they can control it, and engage with their healthcare providers. In other words, they must be diabetes literate. Research shows that in Europe, 10% of adults have inadequate health literacy and 35% have limited knowledge. A critical element to strengthen patient empowerment is diabetes self-management education and support. Various types of programs have been developed, but at a European level, we do not know which ones exist and if those that do are effective and take the patient's health literacy into account. To find the answers to these questions, the Diabetes Literacy Project mapped information from the 28 EU member states. Then, to evaluate the existing programs, we needed clinical, socio-psychological, financial, health service and communication, and e-health expertise. The Diabetes Literacy Consortium is made up of partners from 6 of the EU member states. 3 partners from Israel, USA and Taiwan, and 2 collaborating partners from Denmark and South Africa. Our findings were positive. There is a growing awareness in Europe of the need for diabetes education and support for self-management, and a wide variety of programs do exist. However, it is important that it reaches those with lower education and literacy levels too. Rather than investing in the development of new programs, existing programs should be more available and be accessible to every patient. Do these educational programs work? The project involved in-depth studies among 500 patients. It included various types of programs: individual, group-based, peer-led, and IT-based. Overall, these programs were effective in positively changing behavior. Taking into account the overall cost per patient of DSME programs in different countries, the study demonstrated that diabetes self-management programs are a low-cost intervention compared to other care. Can we make it better? Yes, we can. By embedding programs in national policies, by looking at conditions and components that will make the programs more effective, by developing wider perspectives in IT-based education, and by improving the training of program providers, including a greater focus on psychosocial expertise, by supporting EU member states that lag behind to further develop diabetes strategies that include self-management education. The Diabetes Literacy Programme shows that there is a window of opportunity in Europe to empower patients to successful self-management by raising the quality and effectiveness of existing education programs. It is the responsibility of us all to make sure that this is an opportunity that we now take advantage of at both an EU and national level.